Hello, I'm Martin Woodrow, Chief Executive of the British Dental Association. Here's our monthly summary of the key issues across dentistry. Lots going on again this month across the 4 UK nations. One overriding theme continues to be the perilous state of NHS general practice. Investment and reform are sorely needed, but the situation won't be helped by the news this week that the UK government is seeking to constrain public sector pay bodies, saying that no more than a 3.5% uplift is affordable next year. We'll continue to argue the case that this level of uplift is completely unacceptable. The Senedd Health Committee produced a new report on dentistry this month, quoting extensively from the evidence submitted by the BDA. The committee focused its findings on the unmet need for NHS care. Separately, we issued an open letter to the CDO in Wales highlighting that a growing number of dentists and practices will leave the NHS, and we've surveyed members on the impact of the current reform process. There are some stark results from that survey, which we will be using in our work to influence government. Thank you for providing us with that crucial feedback to support our case. Posting several blogs over the coming weeks addressing various aspects of dentistry in Wales, and we'll be seeking further rapid survey feedback from you. And hot off the press, the Welsh Government has invited us to begin the process of longer-term reform to the GDS contract. Much more to come on that in the coming weeks and months. In Northern Ireland, we've been campaigning on your behalf, making the case that providing NHS care is costing some practices more than they receive in income. Without a change to the system, patients could be denied essential care as costs continue to rise. Media coverage has included BBC News discussing the future of NHS dentistry and BBC Talkback interviewing Dental Practice Committee Chair Ciara Gallagher. This week, we've also written to the Department of Health seeking urgent clarification on what financial arrangements will apply in GDS for the financial year 2023-24. The Scottish Dental Practice Committee is entering a process of formal engagement with Scottish Government over fee allocation within the revised Determination 1 of the Statement of Dental Remuneration. We're calling for interim financial support to continue until the reform system is fully implemented. And following our calls, the bridging payment, which uprates NHS fees by 10% and was originally due to lapse in April, will now continue until October. Recent data indicates that NHS claims from dentists are down 43% from 2019, suggesting a growing exodus away from NHS dentistry. We've conducted a survey to find out what the ongoing uncertainty means for you. The Health Service Journal reported this week that senior leaders in NHS England have major concerns about a record underspend in dentistry in the current financial year. Our own analysis of delivery in the first 9 months of 2022-23 suggests there is no way for many practices to close the gap by the 1st of April. We think the service is on track for total losses of well over 10% of dentistry's £3 billion budget, potentially as high as £400 million given the current trends. This money is not ring-fenced, and the vast majority will end up plugging holes in other NHS budget lines. This clawback, of course, does not reflect a lack of demand for dentistry, but the reality of a service still in recovery, desperately scrabbling to meet complex patient need, with an NHS recruitment crisis across the front line. Changes to the Dentists Act have been confirmed this week, providing the GDC with more flexibility around its processes for the recognition of non-UK dental qualifications. Some changes will formally come into force on the 8th of March this year. This means that overseas qualified dentists will no longer be able to register as dental care professionals on the basis of their qualifications. We know that a lot of applications have been made recently via that route. Some dentists who were partway through the overseas registration exam when it was suspended during the pandemic will now be given more time to sit the exam. That's welcome news for that group whose case we've argued with the GDC. Further consultation will follow from the GDC on its longer-term approach to international qualifications. We'll of course be engaging with that consultation. And it's been a busy week at the GDC. Another important consultation was also launched on scope of practice. Again, we'll certainly be responding to that on your behalf. We worked this month with hygiene poverty charity Beauty Banks on research into secondary schools across the UK, looking at the state of pupils' oral health. The headline from that research was that 4 in 5 teachers are now providing pupils with toothbrushes and toothpaste, and 25% of children are missing school due to poor oral hygiene. And lastly, the news of 37,000 junior doctors voting to strike in March won't have escaped your attention this week. A small number of our hospital dentist members on the same contract have also voted the same way in a BDA ballot. We're preparing communications to them now and will be with them as they stand alongside their medical colleagues.